Today.
Good morning.
Why is there such a shortage of kidneys?
Look, like as the MEC has already indicated, the only challenge that we have is the lack of the shortages of kidneys or donors that are matching. The patients will then have to wait for the matching organs, because if organs are not matching, then it becomes a challenge. But then we have a challenge whereby people are not coming forward in donating. And in some other instances, we have a challenge whereby one would have, consented that they will donate the organs, but then members of the family will then say no, to someone who's deceased, say no, we cannot have the, organs. But then there's a reluctance of people who are still living, and they must actually assist us with the organs, because you can still lead your normal life with one kidney. So, and as such, we'll encourage people to come forward. As you will know, that Charlotte Maxeke take care of other provinces besides KZN and Western Cape. So you'll have an understanding that the shortage has an implication in the country, not only Gauteng, because every patients will then have to come from all over the country to Gauteng or to Charlotte Maxeke for the procedure to be done.
And who are the people that would be the perfect candidates for organ donation?
Look, we'll call upon anyone who is willing to be a donor. There's a process whereby they examine, they will take them through the process and ask necessary questions, and then examine them, their life in terms of healthy living, or are they relevant, the blood types. Those are the things that they will have to check, the health professionals. So we will then call upon the willing people to come forward and assist us as a country.
Now, once you've signed up as an organ donor, and say you pass away and you're still registered, what sort of implication does that have if the family does decide not to let you have the organs that the person has decided to donate when they were still living?
Look, what is important, if you are willing to donate, it's important to interact with your family. Interact with almost 90% of people that are around you. Make them understand why there's a need for you to do that. And as a department, we felt that we'll be going, on a educational drive, going to the centers, going to the clinics, each and every opportunity we find, educate people on the importance of one having to donate, because you will save lives, and we'll have a testimonial whereby people who are leading, their life with donation or donated organs coming forward to say they are so thankful, and those that they have donated will be in a position to can also give us the testimonial to say they have assisted people in the country.
Now, is there only a main shortage of kidneys, or what other organs are hospitals in need of?
Look, we need liver, we need kidney. Kidney is a challenge for us, but then cornea as well. Will be in a position to can have your lungs as well. So each and every organ has a role to play in saving lives, in making sure that people who really are in a dire need of those organs, they are then assisted accordingly. So what we'll do here is just to encourage people to come forward, be willing donors, and then we'll take them through the necessary education on what is it that we need and how we're going to be moving forward. But more so, members of the community and the families to accept when one is consented that they're going to be giving us the organs, so that we then save lives.
And if a person is interested in becoming an organ donor, how do they go about doing that?
Look, we'll encourage them to send an email to us, steve.mabona@gauteng.gov.za, or to visit Charlotte Maxeke, because that's the main center, and go to Steve Biko. There are coordinators there that will assist them, just to make sure that they know what is the next step. But it's important for people to come forward, because we need to do necessary assessment. We need to do, check the blood, and give actually counseling on how to go all about it.
And has government ever considered paying people for their organs?
Look, I think that would be unethical to do such. So we will not even going to, go into that terrain. Hence, we will put more effort in educating people. Why do we need donors? Why is it important for us to donate? Just to make sure that people have an understanding, and to quell any myth, most especially from the African, sector, to say people don't want to give organs because of the other beliefs that people have. So we will, put more effort in education, put more money in education so that people understand why we are doing this and why there's a need for people to be organ donors.
And just quickly, what are some of the characteristics of an ideal donor, and what sort of tests will they undergo before becoming an organ donor?
Look, we will be wary of going public with that, but because it will be more of your, patient, doctor's confidentiality.
Okay.
So we will not want to go much detail, but then we will encourage people to come forward so that when they interact with them, there will be the any person who can, indicate what is it that we need from you. Some information might be too detailed because it's not everyone who will be will qualify
Eligible.
to can be or a donor, or it's not everyone who is eligible to be transplanted or to benefit from from the organs. So those are the things that we look at as health professionals in the department.
Thank you very much for joining us today. A very important issue.